If you suffer from migraines, you know just how debilitating and disruptive they can be. The throbbing pain, sensitivity to light and sound, and overall discomfort can make even the simplest tasks feel impossible. That's where Almotriptan comes in. In this video, we take a closer look at the impact of Almotriptan for migraines, exploring its effectiveness and benefits. What is Almotriptan? Almotriptan is a medication specifically designed to alleviate migraine symptoms by targeting the blood vessels in the brain that are responsible for the headache. Its ability to constrict these vessels helps to reduce inflammation and relieve the pain associated with migraines. By targeting the root cause of migraines, Almotriptan offers sufferers a chance to regain control over their lives and return to their daily routine faster. Almotriptan belongs to a class of medications called Triptans. Triptans are serotonin receptor agonists that work by binding to specific receptors in the brain, which leads to the constriction of blood vessels and the reduction of pain signals. Almotriptan is available in different forms, including tablets, orally disintegrating tablets, and nasal sprays, allowing individuals to choose the most convenient option for their needs. How does Almotriptan work for migraines? When a migraine attack occurs, there is an abnormal dilation of blood vessels in the brain, leading to inflammation and the release of pain-inducing chemicals. Almotriptan works by selectively binding to serotonin receptors, which are found on blood vessels. This binding action causes the blood vessels to constrict, reducing the inflammation and relieving the associated pain. The speed at which Almotriptan takes effect varies among individuals, but it is known for its fast-acting properties. Many users have reported feeling relief within 30 minutes to an hour after taking Almotriptan. This rapid onset of action can be crucial for individuals who need quick relief to resume their daily activities. Effectiveness of Almotriptan in treating migraines. Numerous clinical studies have demonstrated the effectiveness of Almotriptan in treating migraines. In a randomized, double-blind, placebo-controlled trial involving over 1,000 migraine sufferers, Almotriptan was found to be significantly more effective than a placebo in providing relief from pain, headache-associated symptoms, and the restoration of normal functioning. A separate study compared the efficacy of Almotriptan with other commonly prescribed triptans and found no significant differences in their ability to relieve pain or other migraine symptoms. This suggests that Almotriptan is a reliable option for migraine relief, with similar effectiveness to other triptans on the market. It is important to note that while Almotriptan can effectively alleviate migraine symptoms, it is not a preventative medication. It is designed to be taken at the onset of a migraine attack or when symptoms first appear. If you experience frequent migraines, it is advisable to consult with your healthcare provider to explore preventive options. Potential side effects of Almotriptan. Like any medication, Almotriptan may cause side effects in some individuals. The most common side effects reported include dizziness, drowsiness, fatigue, and nausea. These side effects are typically mild and transient, resolving on their own without the need for intervention. In rare cases, more serious side effects may occur, such as chest pain, shortness of breath, or changes in vision. If you experience any of these symptoms, it is important to seek immediate medical attention. Additionally, individuals with certain medical conditions, such as heart disease or uncontrolled high blood pressure, may be at a higher risk of experiencing adverse effects from Almotriptan. It is crucial to discuss your medical history with your healthcare provider before starting Almotriptan or any other migraine medication. Dosage and usage guidelines for Almotriptan. The dosage of Almotriptan can vary depending on the severity of the migraine and individual response to the medication. It is typically recommended to start with the lowest effective dose and adjust as necessary. The maximum daily dosage should not exceed 25 milligrams. Almotriptan tablets should be taken with a full glass of water and can be taken with or without food. The orally disintegrating tablets should be placed on the tongue, where they will dissolve without the need for water. The nasal spray should be administered as directed, following the instructions provided with the medication. It is important to note that Almotriptan should not be taken preventatively or used for more than 10 days per month, as this may increase the risk of medication overuse headaches. If your migraines occur more frequently than this, it is advisable to discuss preventive options with your healthcare provider. Precautions and considerations when using Almotriptan. While Almotriptan can be an effective option for migraine relief, there are certain precautions and considerations to keep in mind. It is essential to inform your healthcare provider about any existing medical conditions, allergies, or medications you are currently taking, as they may interact with Almotriptan. Almotriptan should not be used in combination with other triptans or medications that belong to the class of monoamine oxidase inhibitors, MAOIs. This combination can lead to a potentially life-threatening condition called serotonin syndrome. It is also important to avoid alcohol consumption while taking Almotriptan, as it may increase the risk of side effects. If you are pregnant, planning to become pregnant, or breastfeeding, it is crucial to consult with your healthcare provider before using Almotriptan. While there is limited data on the safety of Almotriptan during pregnancy or breastfeeding, it is generally recommended to avoid its use unless the potential benefits outweigh the risks. Comparing Almotriptan with other migraine medications. Almotriptan is just one of several options available for migraine relief. Other commonly prescribed triptans include sumatriptan, rizatriptan, and elatriptan. While the efficacy of these medications is similar, individual response and tolerability may vary. Some individuals may find better relief with one triptan compared to another. In addition to triptans, there are other classes of medications used for migraine prevention or acute relief, such as nonsteroidal anti-inflammatory drugs, NSAIDs, and ergotamines. These medications work through different mechanisms to alleviate pain and reduce inflammation. Your healthcare provider can help determine the most appropriate medication for your specific needs based on the frequency and severity of your migraines. Almotriptan, prescription versus over-the-counter options. Almotriptan is a prescription medication, meaning it can only be obtained with a valid prescription from a healthcare provider. This is because its use requires careful evaluation of individual health status and consideration of potential drug interactions. It is important to follow the prescribed dosage and usage guidelines to ensure safe and effective use of Almotriptan. While there are over-the-counter, OTC, options available for migraine relief, such as acetaminophen or ibuprofen, these medications may not provide the same level of efficacy as prescription triptans like Almotriptan. OTC options are generally milder and may be more suitable for individuals with less severe migraines or infrequent attacks. It is advisable to discuss your options with your healthcare provider to determine the most appropriate choice for your needs. Patient experiences and testimonials with Almotriptan. The experiences with Almotriptan vary among individuals. Some individuals report significant relief from migraines and praise the fast-acting properties of Almotriptan. They emphasize the ability of this medication to quickly alleviate pain and allow them to resume their daily activities. Others may have had less favorable experiences, experiencing side effects or finding that Almotriptan did not provide sufficient relief for their migraines. It is important to remember that everyone's response to medication is unique, and what works for one person may not work for another. If you have concerns or questions about Almotriptan, it is best to consult with your healthcare provider. Conclusion: is Almotriptan the right choice for migraine relief? Almotriptan has shown promising results in the treatment of migraines, with studies demonstrating its effectiveness in relieving pain and associated symptoms. Its ability to target the root cause of migraines by constricting blood vessels in the brain sets it apart as a valuable option for those seeking relief from debilitating migraines. However, it is important to remember that Almotriptan is not suitable for everyone. It is crucial to discuss your medical history, current medications, and individual needs with your healthcare provider to determine if Almotriptan is the right choice for you. They can help assess the risks and benefits and guide you towards the most suitable treatment plan for your migraines. While Almotriptan can provide significant relief, it is important to remember that it is not a cure for migraines. If you experience frequent or severe migraines, it is advisable to explore preventive options with your healthcare provider to reduce the frequency and intensity of your attacks. In conclusion, Almotriptan offers hope for individuals suffering from migraines, providing a chance to regain control over their lives and alleviate the debilitating symptoms. By understanding how Almotriptan works, its potential side effects, and considering personal factors, individuals can make informed decisions about their migraine management journey. Always consult with a healthcare professional for personalized advice and guidance. Thanks for watching.